Hi, and welcome back to the Dr. Ramsey Show. Most of you knew that when my partner was alive, she ran the office. She was with me for 18 years. Her name was Sue. So I have with us a woman. Her name is Suzye. She spells it Suyze. I just think that's so interesting. And she's here to represent a very important company. The company's name is Galleri. And Galleri is a company that tells us whether or not in this moment we have cancer cells in our body. I'll have Suzye let us know more about this test.
Thank you, Dr. Ramsey. Thank you. Yeah, so Galleri is multi-cancer early detection. With a simple blood draw, you're able to screen for over 50 kinds of cancers. It's detecting is cancer in the blood right now and can help determine where that cancer is coming from in the body. So our overall goal is really, can we find cancer early, and when there's more treatment options, potentially curable for that patient. So that's really our goal.
And when she says curable, what she means is the later we find cancer, the less likely we will have a cure. The earlier we detect cancer, the most likely we can have a cure. And that's why this is so important. Because if we know now versus in 10 years that we have a cancer, there's so much more we can do about it.
Yeah, exactly.
And so I remember you saying there are two cancers that aren't picked up very frequently on your test, and those were thyroid and brain.
Yes, so our test has different kinds of sensitivities across many different cancer types. So our test has a low sensitivity at picking up thyroid cancers or brain cancers, but a very high sensitivity for picking up deadly cancers that don't have current screening, like pancreatic, ovarian, esophageal, or head and neck cancers.
I see. And do you ever pick up thyroid or brain?
It's potentially a possibility, but in the studies and the clinical trials that Galleri has conducted, we just did not pick it up in those clinical trials.
I see. And what it is a patient will come in for a blood test. We just draw their blood like any other lab. Yep. And how long does it take the results to come back?
Yeah, so it takes about 7 to 10 business days. So you'll come in, meet with Dr. Ramsey, do your blood draw, and then about 7 to 10 business days later, Dr. Ramsey will have those results for you.
Right. And let's say we diagnose, a breast cancer. Then, of course, we send the patient for a workup. They get their diagnosis, their actual hard diagnosis, and then we can start maybe a treatment plan that's, it's interesting. I recently, and it's very unusual, I'm not sure if it has to do with COVID or not. I'm reading it might have to do with that. I haven't had many breast cancers in my practice, and the last 3 months I've had 2.
Wow.
And that's a lot for me. Yeah. The first one was, they told her it wasn't a true breast cancer, it was a cancer.
Yeah.
But it was in a breast, but it wasn't a breast cancer. I've never heard that before. This is new since COVID. And the other one's being worked up right now, which is highly unusual. Yeah. By chance, are you seeing more cancers lately?
I think not, in non-relation to Galleri, just personally in my, just working in the field, I think yes. With COVID happening, everything's being diagnosed much later stage because, during COVID, no one went in to get their checkups. No one went in to get their screening. So we're finding cancers at a much later stage, and we're also finding more of them because a lot of people just put off, regular annual visits, blood work, check-ins, that kind of thing.
True. And are there any false positives? Let's say I do mine, it says pancreatic. Is there any chance that might be an actual false positive?
Yes, and thank you, Dr. Ramsey. I think we have to understand there are limitations to this test, right? So nothing is perfect. We do have some false positives, about 0.5%.
0.5, yeah.
Yeah, so it's very, very low, but it can happen. We have a specificity of 99.5%. So specificity means if we issue a negative result, we're very confident it's negative. Okay. So it's really referring to negatives. So very, rest assured if you get the Galleri test, just a few statistics to keep in mind.
Right, but they're very low, the false positives.
Yes, correct.
Right, and no test is 100%.
No.
I have found that. You can't just guarantee one imaging is going to be the whole answer or one blood test is going to be the whole answer. It's never that.
Correct.
But at least it gives us a tool that we can use that we've never had before in our clinic.
Yeah. It's the Galleri, the name within itself is another picture and the patient, right? So how do we get the full picture of what's going on with everyone, right? So it's just a piece of the puzzle, and you do so much here to help your patient. So how do we bring it all together to really understand what's going on?
Right.
Yeah.
I really appreciate your test, because I know a lot of patients will want to do it because they're curious and they want to be preventive. That's what my practice is all about, preventive medicine.
Love it. It's awesome.
Improved quality of life. So this fits right in with what we do.
Perfect.
Is there anything we haven't covered that you'd like to share?
No, that's it for me today.
Well, thank you so much. It's a very interesting test. I haven't used it yet. So any of you who might want to test your blood just to see if there's a cancer that you might have, you can call the office and just do the test. If you're a patient, you have to establish. But it's a beautiful opportunity for you that we've never had before for you. So thank you so much for listening, and we'll be back next week. Bye-bye.